Now in your health news this morning, it's time for our weekly partnership with Asante. This week, Asante's health expert Beth talks with Dr. Kathryn Bacher about the causes and treatments for a very common kind of infection.
A urinary tract infection, or UTI, is a very common type of infection in your urinary system. Though UTIs are common in women, they can also happen to men, older adults, and children. Dr. Bacher, what causes a urinary tract infection, and why are some people more susceptible than others?
So urinary tract infections are caused by the bacteria that are in our stool and live in our GI system when they find a way into our urinary tract. They can be caused by things like holding your urine for too long, having catheters, not emptying your bladder all the way, or in women as they go through menopause and lose some of the estrogen support for their tissues.
So what are some of the symptoms of a urinary tract, and how do you diagnose it?
So the most common symptoms are going to be burning with urination, painful urination, urgency of urination or frequency. The things that are not symptoms are a change in smell or color of the urine.
And then how do you treat a UTI?
So UTIs are treated with antibiotics, and there's different courses for different age groups, different patients, depending on why we have an infection occurring. Typically, patients can also help themselves by drinking fluids or using over-the-counter things such as azo to help their urinary tract flush out that bacteria.
Why do we see these more common in older people? Is there something associated with that?
In older people, especially our male patients, as their prostate enlarges, they're not able to empty their bladder all the way. And that extra urine that sits in their bladder puts them at risk for infections. And then in our female patients, as they lose their estrogen supply during menopause, their tissues are not as healthy, and it makes it easier for the bacteria to enter the bladder.
Thank you so much for being with us here today. And for more information on UTIs, visit health.asante.org.